So here I'm going to talk about little bit about our psychiatric or mental health nursing course syllabi. The course title, Psychiatric Nursing. The course code, NUR 108. And total credit hour, 4 credit. So basically a syllabus is your guide to a course and what will be expected to you in this program or in this course, right? Generally, it will include the course policies, the rules and regulations, and also require information, right? And also a schedule of assignment. At the end of this syllabi, I will show you the class schedule, and also I will give few focus about the grading system. So they said the course description, this course introduced the nursing concept related to psychiatric mental health issues. The unique need of the client with mental health issues are explored buildings on the foundation of previous nursing course. Means fundamental of nursing, adult health, then pharmacology, anatomy, physiology. On base of this, when you get a information about the mental health, you can think critically for nursing process. So this syllabi details important information that fit into an overview curriculum, which is described usually a class in general information session. So it is very important to share or tell you, if you ask me, how do you introduce a syllabi and what are the importance of it? Because every student have to know what they should do. So the student will examine the client response to the threshold across the lifespan, and this course will discuss the pharmacological and non-pharmacological method of teaching the mental health issue. It is really important, right? Because mental health issue is a little bit different than the other subject. Okay. So at the end of this syllabi, I will request you to read it carefully and sign on there, and then so here psychiatric nursing curriculum. So basically a syllabi let introduce the student what the course is about, or why the course is taught, or where it is going, and what will be required for them to successful in this course or program, right? So the theoretical perspectives of behavior will apply to mental health nursing in a practice setting. Advanced concept of communication. So communication, and it would be effective. Use of self, group, and also milieu therapies are used to define the nursing roles which the client and agency in which the mental health nursing is practiced. Maladaptive, emotional, and behavioral expression are studied in the context of mental health continuum and social system framework. The program learning outcome. Hmm? So definitely program out learning outcome about the mental health. Okay. So I always mm, like to request student read each and every sentence and make sure you teach the core syllabi, right? So you should go over the syllabi in the first day, what I like to request you. And also have the student develop their own questions about the syllabi. If you have any, please don't feel hesitate to ask me. And we are here happy to assist you. You can text us, you can email us, and always the school or instructor can reply you, right? So next here, this is based on QSEN or competence. Graduate of the program should able to demonstrate about what? Patient-centered care, right? Whatever I do, everything about uh, about my patient to make them comfortness, because nobody want to come to hospital, right? And they come to hospital to get some peace, comfortness, and be cured from the injuries or illness. So whatever we should do, everything about or related or focused to the patient, right? So also teamwork and collaboration, professional identity. So when you work as a RN in the hospital, you can see we work in a team. We work and each help each other with this collaborative work. And evidence-based, wonderful, right? What I learn, I do practice. What I learn, I will teach who is new, what is good for my patient. Also quality improvement. When you do the practice evidence-based, your quality automatically go up, right? Also safety is important. Safety about your patient, safety about yourself. Also nursing judgment, but never biased by emotion, right? And new one is informatics. So informatics, what we're doing right now, it is the development of informatics systems. It is very new to you. The course learning outcome, what it is, and why students should read the syllabi, my friend. Basically, the best course survival tips is to properly appreciate the role of syllabi. The syllabus is the instrument basically for your professional uses to set the course expectations. And it is the least how grade will be determined or when exams will be given and other important information about the class. Here they said, let me read it. Understand the biological, psychological, and socio-cultural influence on mental health. You see? So psychological, socio-cultural, and also body biology. Understand the selected theories of human development. There are so many theories. The most important one, Erikson development theories. But we also talk about some theory, what is the most accurate for mental health nursing. Differentiate evidence-based from non-evidence-based practice. Analyze the ethics and legal principle related to the care of the patient with psychiatric disorder. Psychiatric patient is very innocent. They do not have that much demand, but they are innocent. They do not do what they're doing. So you have to be very legal, or you have to maintain the principles or ethics. It is not good to neglect them. What you should do with the other patient or other unit, same thing you should do for psychiatric unit. You have to respect your patient. Understand the spiritualities, religion within the context of mental health and illness, right? Also apply the nursing process to the psychiatric mental health nursing too. So every student know the nursing process have a 5 steps, right? Analysis, diagnosis, nursing planning, right? And also implementation and evaluate. So same you have to apply for mental health issues. And describe the essential elements for psychiatric interview and patient and family assessment. So if your patient is adult, usually only talk to the patient is good, but in psychiatric unit, you have to talk to the patient, and at the same time you have to talk to the patient attendants or the family to evaluate or assessment your patient. Understand how to create a therapeutic relationship. Also, communication, it would be effective. So if your patient do not believe you, they do not share their history. So first key is always establish a trustable relationship, what we call therapeutic relationship. Understand the rules of various professional and multidisciplinary teams. Understand the common therapeutic approach and nursing intervention. Also understand the group dynamics and nursing role within the group setting. Identify complementary and alternative and somatic therapies used in the treatment of selected psychiatric mental health condition. So some patient has a trust they will be good in herbal medication, complementary medication, or alternative medication, right? Or sometimes relaxation techniques, musics, yoga can helpful. Understand the roles of inpatient, community, home care, and also forensic facilities in psychiatric unit. Understand the core features and selected psychiatric disorder and associated nursing and also pharmacological intervention. What next? What are the clinical objectives? Right? So at the completions of clinical rotation, the student will be able. So when you finish the whole curriculum with your faculty, the last 2 weeks, we like to request you to participate in clinical rotation. The clinical rotation, we divided into 2. One is simulation lab, that you can get the opportunities in our school. And this simulation lab is just like a hospital. Also, students are allowed to go to the local hospital, local rehabilitation center, or sometimes we have a collaboration with a primary care or doctor office. So you can go, and more than 50% participation, you are allowed to participate, and 50% observationship. So demonstrate the professional standard of moral, ethicals, and legal conduct, right? So if you have a good sense of humor, it is more than enough. Demonstrate professionalism, include attention of appearance, respect for self and others, attention of professional boundaries, right? We have to follow all of the rules and regulation about the police agencies and hospital. Provide nursing care to the family and children effectively, perform basic nursing skill and safety and effectively. So when you participate in the clinical rotation, we will help you to increase or step up your skill. Also administer nursing care based on patient, families present in biopsychological, social, cultural, spiritual situation. So when you work in hospital, particularly mental unit, you have to think about the spiritualities. If your patient have a trust with something, you can't deny it, right? You have to respect whatever it is. So next, demonstrate the patient priorities of need and plan care accordingly. Complete the nursing care for at least 2 pediatrics patients on the time using an organized and effective approach. To be honest with you, when you work in the clinical rotation, sometimes some pediatrics patients automatically come and you can participate. Utilize the nursing process to administer the care of pediatrics patient. Pediatrics patient is very sensitive, right? Very stressful. Also, families clearly define commonly occurring healthcare needs and problems. Collect the data on the patient's health status. Assess the data considering the normal physiological, psychological parameters. Also, state of nursing, diagnosis of each actual and potential problem, which be identified from the patient health assessment. Also, create the safe care of environment that is result in the high quality patient outcome. Provide appropriate patient teaching that is reflect the developmental stage, age, culture, spirituality, patient's preference, health literacy, and consideration of foster patient engagement in the care. What else? Now, here I'm going to tell a little bit the instructional delivery plan. So the format may include lecture and discussion. So when you participate in my class or in class with the faculties, you will get some credit. So lecture on base of discussion, it is not, it is always interaction, means I talk, you will talk. I will explain everything. If you have any question, I will explain, right? So both sides can participate. So computer assist learning process and group and also independent learning activities if need. Each week you will complete the various combination on online assessment, classroom-based assessment, activities, reading, also other method. So like I said, we give you some clinical case, you have to read it. We will give you some videos. You should listen carefully, and then you can write an essay on base of this video. So what you watch, you could write it. So there are no way you can neglect it. So also instructional strategies that may be used include PowerPoint, lectures, discussion, demonstration, also media resources. So like when you come to the simulation lab, our clinical instructor like show you how to maintain the insulin, how to withdraw it. That times we will tell you should do this. So remodeling, demonstration. Also media resources like YouTube link. So there are so many videos, but which one you need to know, right? Because some students work so hard, they do not know what they should know. So we at the instructor can help you to find out what you should know. And you should work very smartly and you will get your license. The role playing, simulation, team-based learning, audio visual aid, computer assist instruction, study and practice groups, case studies. Usually we email you the case studies. You have to write the nursing process and planning, and you should get it back through the email, or you upload in the Google Classroom and your instructor read it and give you the grade. Also clinical assessment, you do it under supervision of instructor. Post-clinical conference, so what you learn, we ask and you explain. Critical thinking, develop this process. Critical thinking tools on assigned the patients, practice and return the demonstrate at campus laboratory. What else? The instructor and student responsibilities, right? I only talk and you only listen. This is not a way. If I talk, you will participate. It should be both sides. It is the interaction, not a lecture only. So instructor of this course assume responsibility to provide information regarding expectations of the student and require assign and activities and date for completion. The major obligation of the student is demonstrate the proficiency while meeting is required for this course. It included in this obligation is necessary of the meeting timelines for completion of the activities, assignment, and quiz and test. Students who need additional help should notify instructor by direct phone call or email or text. And also instructor is ready to respond. If instructor do not do, you also allowed to direct contact with the campus director or program director or student affairs. What are the course requirements, particularly dress code and supplies? So the dress code is important when you come in person to the campus for clinical rotation. So students are expected to wear the school uniform when coming on campus. On other will be permitted. No eating or drinking are allowed in the nursing skill laboratory. Usually simulation lab, or when you go to the clinic or hospital, definitely, right? It makes sense or common sense. For the student safety, student must not wear the sandals fabric shows, or also, you just protect yourself. Student will not be permitted into the nursing skill laboratory with a proper uh, for either class or supervised practice. Students have a maximum of the 3 opportunities to demonstrate the proficiency at the skill during the performance examination. Usually, student will receive either pass or fail, you see. So if you get, satisfactory score, we tell you pass. If you not, we tell you not pass or fail. So based on meeting of critical elements or override for each skill test, students require the third test will be tested by the 2 facilities within the course level other than the original examiner. What next? The method of communication grade, then makeup test, attendance, and class participation. So what are the method of communicating grade? Result for each performance examination will be given to the student in writing immediately after performing of the skill. Student must pass the skill performance examination for mandatory skill, also randomly selected skill. Makeup test, and there will be no makeup examination. And if the student is unable to attend the class on the day of the scheduled examination, the student will receive the fail. But it is also important if student informed before to the instructor, and if instructor allow with a reasonable cause, it should be flexible. Attendance based on concentration of learning in this program, attendance at every scheduled session is super important, my friend. Students who miss any scheduled class are responsible for acquiring the missed information. Also, it is considered of others is expected. What else? What next? So next here, so class participation is an expected behavior. To maximize the student learning, all assignment must be completed before class. Students are expected to actively participate in the class by performing the skill under supervision. So next here, the remediation. So students who are not meeting the course objectives or requirements are expected to practice in the nursing skill or nursing skill laboratory to look for assistance for the tutor or their instructor. It is the student's responsibility to make an appointment with the course instructor for further directions of regarding remediations. So at the beginning, if you know the component of syllabi, like instructor information, course description, or course objectives, or course outcome, course methodology, grading system, or grade component, or course policy, attendance policy, it would be easy to pass the course. Nursing skill and laboratories. So students are responsible for assign the reading, the textbooks, and also completing all videos. So we will tell you what books you need. We give you what videos you need to listen or watch, or what are the assignments prior to lab. Participation in discussion over the assigned materials is expected. Failure to prepare all result in an unsatisfactory for lab session. So all lab session must be completed satisfactorily to progress to the clinical setting. The student must adhere to the clinical dress code for the skill laboratory session. So one student texts me what color dress they need. Usually we prefer white dress, and refer to the nursing student guide for policy informations. What is the clinical experience when you come to school or go to the hospital? So clinical attendance is mandatory to complete this program. Refer to the nursing student guide for absence policy. So when you ready to go to the clinic, you have to provide, or we need to check, complete the checklist. It should be include your physical examination, immunization, your CPR card, your TB status must be current for the student to able to attend clinical experience at the assigned clinical rotation. It is important you have to provide all of the details. So student will be allowed to perform designed nursing skill. Students are expected to meet the clinical expectations outlined in the clinical evaluation tools. Based on the student learning needs, the facilities determine the appropriate amount of time and clinical assignment need to assess the student growth. Faculty may require additional assignment sometime, not always. Clinical work to ensure the student have met the clinical objectives. Students are expected to complete with any additional assignment or clinical hour assigned. Students are expected to prepare the practice in order to provide the safe, competent care. Also, clinical assignment must be 100 in one times clinical instructor, right? Handed to the clinical. So like 5 students go to the clinic. With the 5 students, always one instructor who have the license will go with you to the hospital. What else? Now I'm going to show you what are the method of evaluation and what are the grading scale. First of all, what are the method and what are the percentage you need? So homework or participation 10%, care of plan 12%, quizzes 8%, your midterm 1 20%, midterm 2 20%, and final 30%, all together 100%. Out of 100%, if you get 90 to 100, it should be A plus. If you get 80 to 89, it should be B and B plus. If you get 79 to 75, it is C, means you pass the program. If unfortunately you get less than 75, oh my God, you failed. So below 75 constitute a failing grade. I believe you will get more than 90%. So clinical grade is only pass or fail. So nothing A, B, C, D. Means pass. So the following are the score that will be given at the scale. If first successful attempt, 100%. Second, 89. And third, 79%. So all skill make up or retake will be made up during the open lab hours. Student will have until the end of unit to make up or retake any skill, or grade will automatically be changed to 0. I believe you will not do this. It should be 100 for you if you actively participate in the program. It is solely the student responsible arrange makeup or retake time any unsuccessful skill. So what are the textbooks or materials we request students to go? So Fundamental of Nursing, 9 edition. The Potter is and Hall is writer. So also this is the mental health, right? So now let me tell you the course schedule or calendar. So this is the date and week 1, week 2, 3, 4. So week 1, Fundamental of Nursing is Fundamental of Psychiatric. The Center book, chapter 68, page number 987 to 999. So in the same time, you do practice question from Evolve. And what I like to request my student, please practice 100 questions per day. And if you do this, and Evolve has a 4,000 questions, you can finish by 40 days. So next week 2, mental health disorder part 1. Week 3, mental health disorder part 2. In the same time, quiz 2 and quiz 3. Center book chapter 68, chapter 69, and practice question from Evolve. Next week 4, addiction or substance abuse, alcohol withdrawal. Everything we discuss in this week 4 and quiz 4 and Center book chapter 70, page number here 1019 to 1029. Then you have to sit for midterm exam. So midterm exam or any quiz link you will get in Google Classroom. The student who are active or always updated in the tuition, they have a quiz link or all materials in their Google Classroom account. Particularly what I do, I send the quiz link by email, and different instructor has their own style, but and student can easily adapt with their system. Week 5, we will talk crisis theories, chapter 42, right? And week 6, all psychiatric medication. Usually I give you the note in 2 pages, all medication, side effect, their nursing key points, and also the drug interaction with, right? Everything is 2 pages. Center book chapter 42, you do practice question. What next? Week 7, summary review, watch the 3 videos. So this each videos more than 1 hour. We give you also, you are able to get in our Google Classroom, you can review everything. But also we provide the PowerPoint, we provide the assignment, we provide the some note that is really, really important or essential for the student, right? So if you ask me, how does the course summary work? in Google Classroom. Basically, the code summary display in published and unpublished assignment with their due date in chronological order automatically. A student can only view the published assignment. If you want to update the course summary, you should do so by updating the assignment due date of assignment or course calendar. So everything you are able to get in our Google Classroom, and every student have this, right? So finally, final exam you have to sit. So now something more important about psychiatric mental health nursing syllabi, and we called acknowledgement form. It is very important. You have to read, then you have to sign and email me, and I will put it in your file. So particularly here, we are going to talk what are the purpose of syllabi. So like here, I said a syllabi let the student to know what the course is about, or why the course is taught, or what it is going, and what will be required for them to be successful in this course, right? So like I understand that it is my responsibility to review the syllabi, you see, and also enter and also look for clarification for any questions or concerns that I have. I understand that the syllabi may be amended or and replaced or during the course curriculum. In the events of an replacement, I will receive the notification of change. Also, a new copy will finish to me via paper or electronic means by email. I understand that it is my responsibility to review any replacement and their entirely and to adhere to the newly any kind of rules and regulation policies. I understand that the policy outlined within the syllabi have implications on the grade I earn. I understand that I may be withdrawn, may be suspended, or expelled if I do something illegal, or fail the course if I do not meet the requirements, if I do not adhere to the policies. So my signature below that I have received the psychiatric nursing or the course code 108 syllabi and understand the policies and outline, right? And here in the agree to adhere to them. So if you are agree with me, or if you agree with the syllabi, if you know what are the course or what about it, or what are the topics or subject we teach you, or what it is going, or what will require for you to success this course, then you have to print your name and you have to signature and you type your date and you can email me. Okay, this is very basic about the syllabi and the class schedule.